Hi, my name's Lorna, I'm 33 years old and I'm 7 months pregnant with my third baby. Before becoming pregnant, I tried to keep myself fit and healthy. I ran 3 times a week and completed 2 half marathons. I spoke with both my midwife and my personal trainer, and they told me that as I'm already fit and active, there should be no problem with me carrying on with the same amount of exercise as long as it was still comfortable. I did stop during the summer holidays while spending time with my children, and I haven't really gone back into it for fear of it becoming uncomfortable.
Hi, I'm Laura, I'm 25 years old and I'm 3 months pregnant with my second baby. When I had my first baby, I was overweight, but now in my second, I found out I'm slightly heavier than I was the first time around, and now I have a high BMI and need extra scans. If I'd have realised, I would have tried to lose weight before becoming pregnant, but now my baby is on the way, I want to do what I can now, so I don't put any more weight on. I'd like to start exercising, but don't know what would be safe for me and my baby.
Hi, my name's Elise, I'm 25 years old and I'm currently 5 months pregnant with my first child. Before I got pregnant, I used to be a bit of a fitness fanatic, and my job in events involves lots of outdoor activity, and I'd do some form of exercise every day. I stopped all exercise as soon as I found out I was pregnant. This was because I've had 2 previous miscarriages before this pregnancy, and I was worried that it might affect the chance of me carrying my baby to full term.
Hello, I'm Dr. Hilary Jones and I'm here to clear up some of the myths about what exercise you can and can't do during your pregnancy and what's right for you. I'm going to show you how keeping active is not only safe, but it's actually good for both you and your baby. Pregnant women should aim to do similar amounts of exercise to anyone else, building up to 30 minutes a day, at least 4 times a week. Many women understandably worry that moving around a lot isn't going to be good for their baby, but they will be secure enough to withstand most exercise. All the evidence shows that there's no increased risk of miscarriage, of birth defects, or of having a small baby. And what's more, exercise is actually good for both of you. Here's how it helps. First of all, it reduces the risk of complications such as high blood pressure or gestational diabetes. That's the diabetes that occurs during pregnancy. It reduces tiredness, varicose veins, aches and pains, and even swollen hands and feet. And on top of that, it helps with tackling insomnia, feelings of stress, anxiety, and depression. Finally, the stronger you are, the better you'll be able to cope with the weight of your growing baby. The baby will also benefit from improved blood flow through the placenta, and you'll have fewer complications, meaning that you're more likely to have a healthy pregnancy and a healthy baby. So what exercises can and can't you do? Well, any activity that makes you feel warm and slightly out of breath counts towards your goal of 30 minutes of activity a day. Brisk walking, going up and down stairs, even vigorous housework, they all count. And if you're not used to exercise, however, start slowly. You can do your 30 minutes in 10-minute blocks and build up from there. You're fine to do a dance class, to jog or swim, and in fact take part in most sports. The only ones to avoid are things like scuba diving and anything in a very hot environment like Bikram yoga. And women should be cautious about potential loss of balance and collision in contact sports, in gymnastics and things like cycling during pregnancy. If you get too hot, stop and cool down, and as with any exercise, always stay adequately hydrated. But what if you're thinking, I might not feel comfortable exercising, or that you'll be too tired? Well, as your bump gets bigger, there's more strain on your muscles, your joints, and your ligaments, so you may need to adapt your exercise. Walking, yoga, Pilates, swimming, and gentle weight training and gardening are all gentle on your joints. Being active will actually reduce your tiredness. It'll also help to improve your stamina, which will help you with the delivery. If you have a high body mass index, say over 30, managing your weight is even more important. Now there's lots of activities you can do, but make sure that you build up slowly to do daily exercise. Brisk walking, pregnancy exercise classes and swimming will be great for you, but avoid running or jumping as they will be hard on your joints. If in doubt, always speak to your midwife or your GP about exercise, because that's what they're there for. And remember that exercising in pregnancy is safe, everyone can benefit from it, and most importantly of all, it's healthy for you and your baby.